So, hello everyone, myself Punjal Chandrakar, and we have here with us Dr. Prosenjit Mondal, professor at IISER Berhampur and a researcher in metabolic disease, insulin action, and inter-organ communication. A very, very warm welcome to TDM, sir.
Thank you.
Could you shed some light on what inspired your journey into exploring metabolic diseases into molecular and inter-organ level?
Okay. So, briefly, I can mention the genesis of the research that we were doing in the lab. So, when I started, like I mentioned, I must finish my master's in India and then did my PhD. And when I went back to I postdoc in Hopkins and then US. So that the lab I work on, they're working on the pancreatic beta cells. So majorly they're working on that how the dysfunction of pancreatic beta cell happens in type 2 diabetic patient, and eventually we try to develop some mice model. But when I come back to the India to start my lab, then I realized that most of the data that we have for the type 2 diabetic patient as well as for the NAFLD is from the Caucasian population. So there's very few evidence and data is there from the Indian patient population. Although we have a significant number of type 2 diabetic patient and fatty liver population in India, but unfortunately there is very few basic studies and that all the pathway and molecular mechanism is known from the Indian population. So all the drug that we are consuming and all the mechanism that we know is everything derived from the Caucasian population, either from the US, Japan, or Europe. There's nothing has been known from the Indian population. So we thought that as there is a huge scarcity of the data from the Indian population, we thought this is the best time, the basic scientists to collaborate or come back, collaborate with the clinician and try to find out what is the problem that is happening in India. That's ultimately the driving factor for me to start a metabolic research lab in India.
On that similar note, since India faces unique research and clinical challenges in diabetes and obesity, in your view, how can the Indian research community harness its strength for global impact on metabolic disease outcome?
Yeah, so this, if you check the figure, the number that you're having, the prevalence of metabolic disease, particularly like type 2 diabetics and MAFLD, like fatty liver disease, the percentage of the number as well as the prevalence is really high. So we are almost one of the global top patient with having the type 2 diabetes. So here definitely we need more research. So what we like me, this particular conference where I am in, and there are lots of basic researcher as well as the clinician. So I think we have to come together and the basic researcher and clinician has to work hand in hand and try to find out that what driven those metabolic disease. And if we understand the driven factors, then only we can come for the therapeutics. So I really hopeful that next couple of years, maybe the next 10 years, the more researcher, more clinician will come close to work together and try to find out the underlying mechanism as well as the therapeutic for this disease.
So, since we are in a platform like TreatDM, how do you think how effective TreatDM is in fostering a collaborative approach to advancing healthcare as well as research?
Yeah, I think this if you consider the Indian context, there is very little platform are available where the clinician and the
Yeah.
basic scientists can interact and cross-talk with each other. So I find this Street DM is a fantastic platform, not only for the clinician, but as well as for the basic scientist, where for last 3 days, we interact, we listen lots of clinician talk. I'm sure that clinician also listen lots of the basic scientist talk, and it's created a huge ambience and give an opportunity to work together. Until unless the clinician and basic scientist work together, is very difficult to come with a therapeutic implication that you are talking. So I hopeful this kind of platform, not only the Treat DM, some other platform will also come into picture where the basic scientist and clinician can work to get a chance to interact, listen each of them, and try to find out what is the problem, what is the lacuna, what is the gap, and their collaborative effort, I'm sure we can overcome lots of pitfall and eventually we can come with some of the therapeutics from Indian origin therapeutics. It will be useful for the Indian context.
Yeah. So, lastly, what advice would you offer to young scientists and clinicians who aim to bridge between fundamental discoveries and practical therapies in metabolic disease research?
So what I observed for last 3 days here, I could see that lots of students for the undergraduate, masters, PhD student, even that MBBS student, they attend this conference. So this kind of platform was not earlier. Like when I do it, my PhD, when I was doing my masters, there is any platform where the basic scientists and clinician presented together in the same platform, and I could get a chance to listen both the basic scientists as well as the clinician. So I think this platform, I'm sure that the student will be excited, and that will create some buzz among the student. Try to find out the prospect from both clinician aspect as well as the basic science aspect, and that will create a mindset for the undergraduate or postgraduate student to train their mind, ask very specific question that is pertinent and relevant for the Indian context, and that will be definitely useful for futures to come, and come with some of the molecular mechanism which ultimately leads to the disease and how drug act. So those things definitely ignite the mind, and the young mind, they will be really benefited.
Yeah. So thank you very much, sir, for your precious time and valuable insight. I really enjoyed our conversation.
Thank you. Thanks for it.